anticipated date in the calendar. Not the party in the USA, but the Christmas party. And with COVID cancelling them last year, plenty of people are eager this year to make up for lost time.
But would staff's celebrations cause a spike in COVID infection rates? And would it be more sensible to call the party off now to try and make sure there are no restrictions ruining Christmas Day this year?
I love office Christmas parties. It's like the best time of the year. Good for team bonding.
You can still do things, you just don't necessarily need to do it, but you could make smaller groups and go as a smaller group or try and do it a little bit later.
I work for a small business, so it's quite important for us to work closely together, and it's a good time to get everyone together and reward them for a hard working year.
But I do miss office Christmas parties. I had one before COVID and it was amazing, so I do miss it.
Because you can go into shops and you can dine, I think absolutely you should have a Christmas party, but be safe and be careful.
Joining us now, our clinical lead in urgent care, Dr. Syira Ahsan, whose father died of COVID almost a year ago. She says hospitals are struggling, so we should call the party off. And club and restaurant owner Alex Proud, who says clubs are safer than supermarkets, so we should keep the celebrations in the diary. Thank you. Good morning to you both.
Dr. Syira Ahsan, I mean, you know, our hearts are with you, and this is, you know, as we're talking about celebrating, you are thinking about marking a year since you lost your father. And as everybody else, you know, there's a lot of talk, isn't there? We've got to learn to live with it, and we need to get back to normal, and we need to start enjoying things again. Your mind must constantly be coming back to, you have to understand the tragic consequences of being reckless.
Absolutely. And it's actually a daily reminder working at the front line in the urgent care centre where you see spikes, you see it through the front door before you even see statistics. So COVID absolutely is something that's made us all reconvene how we do things. We have a new norm. I think it's a little bit premature to say that everything needs to go back to normal. And what is normal now? I think we've got a new level of normal where we need to be a little bit more sensible. We have had, second doses up to 70%, but Public Health England statistics say that even if you've been doubly vaccinated, you still have a 1 in 5 chance of developing COVID. So I think everybody needs to err on the side of caution. Having spoken with restaurateur owners and, other public sectors, they've actually said themselves that the public have now started being a little bit more aware on their own volition, where they've not come in at this time of year, recognising that we're hitting winter. We've got winter pressures within the NHS, and they've done the sensible thing of staying away.
Dr. Syira, may I just ask you, though, what I find difficult about this is we're talking about office Christmas parties, but at the moment we have nightclubs fully open, restaurants open, no masks in there, no vaccine passports within England. There are in other parts of the United Kingdom. So what is the true additional risk of a Christmas party when you put it into that bigger mix?
Well, look, COVID spread via airborne transmission, via droplet spread, by surface contact, worse in closed spaces which are poorly ventilated. You had Broadmasters, you had this huge surfing festival in August, which was outdoors. You can get better ventilated than that. And you had a surge of 5,000 cases of COVID linked back to that festival. And Cornwall couldn't cope. And I know because I was working in Cornwall at the time. So really, we've already hit 95% bed occupancy within the NHS before we've hit winter peaks. That's unprecedented. We've never had that before. So if we then go on to have a spike due to the Christmas gatherings, the NHS won't cope.
And can I ask, are you calling for personal responsibility and individuals to take more personal responsibility, or would you like to see government regulatory change on this?
I would like both. I would like both. We've seen the devastating effects of COVID, over 100,000 deaths. With the NHS is not in a great place. You've got COVID spikes along with your normal flu, other respiratory diseases, and cases that we're seeing a lot earlier than we normally would have done because of the isolation lockdown. So we need to tread very cautiously. I do think, it beggars belief that the government has an instigated plan B for simple measures which aren't that obstructive, sort of mask wearing, 2 metre distancing, working from home when you can. We do need to really look after our NHS, look after our vulnerable in this very critical period of time.
Yeah. It's a really important message. There is another side to it, of course. Alex Proud, you own clubs, restaurants, founder of the Nighttime Industries Association. There are thousands of businesses, of course, for whom this is the time of year. They need to try and get some revenue back. And there are thousands of people who feel like they perhaps need to just have a relaxing Christmas get-together. How can you, having listened to Dr. Ahsan, how can you make it safe for people?
Well, I mean, first of all, my condolences to you, Doctor, but I need to be clear on statistics because you've used some there that I do disagree with. We've basically, most of the restaurant sector, since we reopened in July, have been operating at near 100% capacity in terms of we've been full, the public trust us, we're well ventilated, we're well cleaned. We always were. We were the sector of the economy because of health and safety and how strict it is, that is incredibly safe. Government statistics show that during the entire pandemic, the hospitality infection rates are sub 2% compared to workspaces being over 30%, hospitals 40%. You know, let's face it, at the moment, this surge we've had of infections is in almost entirely secondary school. If you look at the 18 to 26-year-old segue of the population in Scotland, they've seen antibody rates at something like 95%. If we were going to see a spike from hospitality, we would have seen it months ago. And Christmas is going to be full, but we're full at the moment anyway. So I don't think you'll see a spike. The spike has come from schools going back. And really what's critical now isn't so much talking about trying to close hospitality, which has 3 million jobs reliant on it, and also a vast chunk of the Chancellor's revenue reliant on it. We need to be talking about those 12 million people eligible for a booster vaccination, and only 50% have had, and the government advertising campaign around that is appalling. I think we need to look at 5 million people who still haven't had their first vaccination. This is the area that needs work. 2% of infection rates means that trying to half close restaurants, pubs and nightclubs during December and ruin everyone's Christmas to save Christmas, let's face it, most of us probably prefer the office party to Christmas itself, is also not going to work. If the spike was going to have occurred from hospitality, it would have happened long ago. The spike is to do with secondary schools. Hospitality is well ventilated. The air in my nightclubs and restaurants is changed every 10 minutes, which is probably better than your studio.
Alex, thank you for that. May I just put that back to Dr. Syira? Dr. Syira, what Alex is saying effectively is the numbers from hospitality is trivial compared to other causes. So shall we just let it happen? And is it time that we got used to COVID being here, I suppose?
Didn't we try that last year, where I understand it's not the hospitality, but we said that people could meet and then, you know, that they got together and we had a spike in numbers. So what I'm saying is absolutely. So you've got to remember, my day-to-day is seeing patients who come in and through the front door with COVID symptoms. So I see it every day. I see the death. I see the difficulty people go through. So I'm not saying cancel anything. I'm saying people need to be cautious. We need to have steps in place. I do think we should have numbers limited. I think we are not out of the woods yet. And if we do then see a spike because of nightclubs, and I know you're saying that they're well ventilated, but they are a closed space. We should have masks. We should have limitations on numbers. We should, obviously, everyone's doing the testing. You're right with regards to the booster. We've only hit, I think, 15%. It's 10 million people, but still we're lagging behind. Yeah. So we've got that to push forward. But knowing that statistic, then surely we need to be sensible in that we don't open the floodgates and say everything's fine. Look, our numbers are lower than the hospital. Of course, they're going to be lower than the hospital. We see that's where everybody comes when.
Okay.
Thank you very much for that, Dr. Syira. You know what? From just the way I read on social media, we've epitomised the national debate there, where the nation is split with different types of attitudes. Do we live with it, or do we do everything we can to protect ourselves from it? And no, there's no right answer on it, unfortunately. There
isn't. Dr. Syira Ahsan, thank you very much indeed. Alex Proud, we understand your concerns as well. It's a strong defence, and all the best to both of you. Thank you.